Thank you for joining us. My name is Randy, and here to do another talk on COVID and specifically the Omicron variant that is now very prevalent, obviously, in our country. And we have the source of all sources here, Dr. Luis Ostrosky, our Chief of Infectious Diseases at McGovern Medical School at UT Health Houston. Dr. Ostrosky, thanks so much for joining us.
Thank you, Randy.
And so, can you tell us a little bit about what the impact has been of the Omicron variant? Last time we talked, we were basically saying this is coming. Be ready for it. Be ready to, reenact some of the measures that we had been taking. So, what have we seen so far?
Yeah, so much like we saw in South Africa and the UK, this variant basically explodes. It creates an explosive number of cases, and I think we were perhaps even underestimating how fast it was going to spread throughout the United States. It turns out that over the course of 3 weeks, it became the dominant variant throughout all of the US. And we're seeing, hundreds of thousands of new cases per day. Um, Again, luckily, this appears to be milder for the vaccinated and particularly those that have received a booster. But like we have been saying all along, even if it's mild for the majority of people, we still have a percentage of people who are going to get really sick, are going to end up in the hospital, a percentage that's going to end up in the ICU, and a percentage who is unfortunately going to die. So just by sheer numbers, the key word here is sheer numbers. Once you start seeing hundreds of thousands of people getting infected, you're going to saturate the healthcare system, and that's what happened to us over the holidays, and that's what we're seeing right now in hospitals throughout the United States. And the very interesting thing that happened is that for those that got mild disease, they're still out of work and they're still staying at home and not being able to staff the hospitals and staff their planes and staff the supermarkets and the gas stations. And it created kind of a crisis over the holidays that we're still experiencing right now, where things are not reliably staffed and reliably being able to be open.
We've heard a lot from the CDC. They seem to go back and forth on a lot of the sort of restrictions and suggestions and things like that. So the most recent, if I remember correctly, is that you're expected to isolate for 5 days after you've stopped getting symptoms. Where are we at currently with that?
So there's two rules that we needed to discuss today. One is what happens when you test positive for COVID. So if you get COVID, test positive for COVID, the rule is you need to stay home for 5 days from the onset of symptoms, if you are experiencing symptoms, or from the day of the positive test, if you're asymptomatic. And you can come out of isolation, we call that isolation, on day 5 if you don't have a fever and if your other symptoms have improved dramatically. And then the part that people forget is that you just don't come out and go and have a party. You need to be wearing a tight fitting mask for the next 5 days because there's a small chance that in this 5 day period after you're out of isolation, you may still be shedding some of the virus and infecting other people. So it's 5 days at home, 5 days out with very strict masking. And I do want to emphasize because people forget about the masking part. And we have been hearing about some businesses and school districts here in Texas where they don't have a masking mandate and they have interpreted as we can't ask you to mask after day 5 when that's a real problem for transmission. The other situation is what happens when you get exposed to COVID. These are the exposures, the close contact with somebody with COVID. And here, being vaccinated makes a big difference. If you're vaccinated and boosted, basically what the CDC is telling us is you can continue your normal life, you can continue to work or go to school wearing a tight fitting mask for the next 10 days and monitoring yourself for symptoms. If you develop any symptom, you need to be tested. They also recommend, as a precaution, testing on day 5 to see if you were incubating and now acquiring the disease. If you are not vaccinated or not boosted, basically, the quarantine period is 5 days. They ask you to stay home for 5 days, test on day five, and if you're negative, you can come out wearing a mask for the next 5 days and being very, very careful with detecting any early symptoms and testing again if you need it. Um, a lot of people have trouble with these rules. They feel unsafe, because we're releasing people earlier from isolation or quarantine. A lot of people feel that they're excessive. There's always the other side where people say, this is not a big deal. Why am I quarantining and not working? But I feel that this 5 day rule is leveraging science that we know about Omicron, where Omicron is most infectious from 2 days before you become symptomatic to about 3 days after you begin your symptoms, with the real need to get society out moving and working and studying. So it's kind of a fine walking line that CDC is working here, um, trying to make it safe for everybody, but at the same time trying to avoid national shutdowns and collapse of infrastructure.
I wanted to touch on masks real quick. So you mentioned a couple times tight fitting masks. So near the beginning of the pandemic, we were talking about basically any kind of face covering would have helped with mitigation. But now we're talking about specifically with the more infectious Omicron variant, tight fitting masks, surgical masks, N95s. What would you recommend people do? Should we just throw away our cloth masks at this point?
Yeah, so it is very clear that not all masks and face coverings are created equal. We've been accumulating more and more and more evidence, showing that, for example, gaiters and cloth mask are very inefficient in preventing any transmission. So we definitely want to move away from gaiters and face masks. And then you can go to the regular surgical mask, double surgical mask, and then KN95, N95, and other respirators. And those increase the level of protection for the person that is wearing them, as well as the person that is um, maybe infectious and trying to contain that virus within their space. Another thing that we've learned very clearly, and this is not controversial, is that masks work better when everybody's wearing them, both the people that want to protect themselves and the people that may be infectious. Um, and that's why, if we were more sort of conscious of each other and kind to each other, we would not be having this masking fight. People say, well, I already had COVID, I don't need to wear a mask, why do I care? And the reason is that, again, masks work better when everybody's wearing them. And you need to think about people. You need to think about your office mate or your person you're sitting across in the bus, that they may have a immunocompromised person at home or a child that's not eligible to be vaccinated yet. And it's just really very heavy on me lately how unkind people are being about this pandemic.
Obviously, thank you for everything that you've done throughout the pandemic to help us get through it and at least get to this point with as many of us healthy as possible. And I'll tell you that I tested positive for COVID over the holidays as well. Obviously I've been fully vaccinated and boosted, and as I've been as safe as possible. And luckily, I had mild symptoms, and everyone else in my house had mild symptoms. But we had someone in my house that did not actually um, contract COVID because we actually wore masks inside of the house as much as we could. So I will tell you that I'm a firm believer in vaccinations and wearing masks, and really just trying to help other people by not spreading it. So I think that's a really good point that you made. I would like to get into vaccines a little bit because clearly they've had a huge impact on helping us get healthier and helping us move forward away from some of the worst stages of the pandemic. But as we kind of predicted from what we saw in South Africa, the Omicron variant has been really good at evading vaccines, at least as far as infecting people. So why is that? And why is it still important to be vaccinated? What are vaccines doing at this point? Is that maybe the reason that I had, mild symptoms, even though they were frustrating and annoying. I felt better after about a week. Is that because I was vaccinated? Is that because I was boosted? And why should someone still get vaccinated, even though they might or even probably will get Omicron at some point?
Thank you, Randy, and thank you for sharing what happened to you over the holidays. I think you're not a test case for failure, you're a test case for success. Vaccines worked by preventing you and your family from landing in the hospital, even with this more infectious variant. This variant is reaching numbers of transmission in the range of measles or chickenpox, something we had not seen before with almost any other respiratory virus. So undoubtedly, this is a very, very infectious virus. Takes very little contact with somebody who's sick to get it, and it is different enough from what we call the ancestral strain, the original strain, that the vaccines that we had designed for those original strains are not working as well in preventing you from getting the disease. We have new estimates of efficacy for both the original series and the booster. CDC is telling us that the efficacy of the original vaccine series to protect you from contracting Omicron is about 35%, much lower than the 90s that we were seeing for the original strain. However, when you're boosted, this efficacy goes to 75%, which is pretty good. Not perfect, and people are going to break through when they're boosted. But the good news is that even if you break through, the efficacy for preventing hospitalization and death is still exceeding 90%. So, what these vaccines are doing, if they're not 100% preventing us from getting infected, is preventing us from getting very sick, landing in the hospital, and dying. And that has always been the case with certain vaccines. I mean, for example, the flu vaccine that we get every year not reliably prevents the flu, but even if you get it, you're going to get a much milder form. And this is the state we're heading to towards the COVID vaccines.
Yeah, I actually heard that the flu vaccine this year, basically every year, the flu vaccine is an estimated guess, right, as to which strain
Right.
is going to be the most dominant. And the one this year was an incorrect guess. Happens sometimes, but you see few people being hospitalized or with major symptoms that have gotten the flu vaccine. I personally actually got the flu vaccine and the booster shot on the same day. My arm didn't feel great, but I'm sure it'll help me in the long run. So the based on evidence we've seen in South Africa, the Omicron variant, at least there, seemed to go away almost as quickly as it arrived. Is that something that we can expect to see here in the coming month or two?
Yes, so we're actually expecting Omicron to peak here in Texas and in most of the United States sometime in late January. So in the next 2 weeks, we're going to see the highest level of cases, and then we expect for it to drop very quickly, over the course of, again, about 3 to 4 weeks to the levels we were seeing before this winter surge. So um, very difficult to predict exactly how we're gonna relate to South Africa or the UK because we do have some different sort of idiosyncrasies as far as vaccination and masking and transmission, but all the models are converging on a peak late in January with a quick drop off after that.
Now, with how infectious it is, it almost seems like it's inevitable that a large portion of the population is going to get it. But um, why is it important then, if that seems almost futile to a lot of people? Why are we still? Why is it still important to mitigate as much as possible and to prevent the spread?
Yeah, so I actually think that it's not inevitable. I mean, if you wear a mask and if you're vaccinated, you have a very good chance of not getting it. Some people are going to get it, and what we're trying to do currently is to do some messaging to pace it out. I mean, if everybody gets it at the same time in the next 2 weeks, we're going to completely overrun the healthcare system. We're going to completely collapse transportation, energy, food industries, etc. So we're back to the famous phrase, which was flatten the curve, right? So we're not necessarily sort of trying to avoid absolute number of cases, but we're trying to pace them out if possible so that we don't collapse our healthcare system and our basic infrastructure.
We've heard talk about the Omicron variant, with how infectious it is, potentially getting us a lot closer, a lot quicker to herd immunity than we had previously kind of expected. You and I have talked about herd immunity before and how we hope to get there through vaccinations, not so much through infections. But what does the Omicron variant mean for our sort of journey towards a potential herd immunity towards COVID?
Yeah, so I definitely think that between the large number of people that are getting infected with Omicron right now and sort of the ramped up vaccination efforts, we're going to reach a state of herd immunity. And the key here is how long is it going to last? Because we know that natural immunity wins over time, as does the immunity we get from the vaccines. So the key here is that this is kind of a unique window we're getting to try to eradicate as much as possible and avoid a new variant in the future rising up and taking advantage of lower immune status, in 6 to 8 months, let's say. So um, I think it's an interesting proposition, but what matters is what we do after this wave and sort of keep up the immune status of the community to avoid further variants popping up. Um, the other thing I do want to mention about herd immunity is that it's never been a strategy that we would rely on because uh, inevitably there's people that don't do well with this virus, right? So sort of relying on herd immunity as a strategy to get out of the pandemic is going to cost hundreds of thousands of lives, and the cost is too great to rely on this for our exit strategy.
Well, Dr. Ostrosky, thank you again so much for joining us, and thank you for everything that you do. I sincerely hope that um, this wave will be over soon, and that we can all stay healthy.
Thank you very much and stay safe.